Assalamualaikum warahmatullahi wabarakatuh. Welcome to the learning video, and today we will discuss about fluid and electrolytes balance as a part of basic biomedical science course. So let's open this presentation, this video with a case because it will give you the reason why we need to learn fluid and electrolytes balance. So the case is of a patient, a 68-year-old woman, which is elderly, with a history of hypertension and diabetes, admitted to the emergency department after 3 days of severe diarrhea and vomiting due to acute gastroenteritis. So, from the assessment, it is shown that the patient has a low blood pressure and then very fast heart rate. And the heart rate pulse is actually weak and the respiratory rate is increased, the temperature is also increased. The skin is dry with a poor turgor and with the sunken eyes. The capillary refill time is slower and the urine output is very low. Not only the patient is dehydrated, the lab results actually show that the patient has hyponatremia and also hypokalemia, which is more life-threatening in this condition. And also the kidney function shows that the kidney actually hypoperfusion. So before we learn how to treat patient with this condition, we need to understand how the body fluids and electrolytes work in our body. So fluids is actually a carrier. It acts as a carrier of nutrients and also waste. And the fluid in our body is not only consist of intracellular fluid, it also consists of extracellular fluid. And these extracellular fluids consist of the fluids inside our vascular and then the fluids in between the cells or interstitial. Electrolytes actually consist of several type of electrolytes, but we will focus on the sodium and potassium because these two body salts actually help the nervous system and also how the muscle can work properly. So the water and also the molecules inside the water actually keep moving in our body. And this movement actually consists of three processes. The first is active transport and then also diffusion and osmosis. We will discuss about diffusion and osmosis first. So the diffusion and osmosis is actually a passive transport of the water. So what is diffusion? Diffusion actually picture the movement of the particles. So when the particles move from the high concentration to the lower concentration, we call it diffusion. The example of diffusion is the movement of the oxygen. So oxygens actually move from the alveoli to the capillary vascular inside the lungs. Yeah, the lung, the respiratory system. So the oxygens actually diffuse from the alveoli into the bloodstream, and the carbon dioxide from the bloodstream also move to alveoli, yeah, which will be excreted uh, in the respiratory system. Another example of diffusion process is the movement of glucose from the bloodstream into the cell. But the difference from the oxygen and carbon dioxide movement is the glucose movement actually is helped or facilitated by the glucose transporter proteins. So we call it facilitated diffusion. The second process is osmosis. In the diffusion, we learn that The ones that is moved is the particles. On the other hand, in the osmosis, the movement is actually from the water. So the water is the one that is moving. Yeah. So the water move from the high concentration to the low concentration. And uh, we need to remember that the high concentration here means high concentration of the water. So the water actually move from the place with a lot of water into the place with less water. So it can be translated as well that the water moves from the low concentration of the particles to higher concentration of the particles. And then the last process is active transport. Our body, our cells, yeah, the cells in our body actually consistently doing active transport of the particles of natrium and also potassium. So this active transport is a function to keep the balance of the intracellular and extracellular fluid. So in order to keep the balance, we use energy, yeah, to keep transporting the sodium and also the potassium inside and outside the cells to keep the balance. So this is the process of active transport, which in which we use energy to open and close the gate for the calcium and also sodium to transport inside and outside the cellular. So we have the normal range of its electrolytes, but I want to emphasize on these two electrolytes, yeah, sodium and also potassium. Don't get confused. Yeah, we also call sodium natrium, and potassium is also the same as calcium. So don't get confused. It's the same. So sodium or natrium has a function to control water balance and also to help the nervous system to give nerve signals. And potassium is very important in the how the muscle work, yeah, including the muscle of the heart. So imbalance in potassium actually will disturb the heart function. Next, we will discuss about common fluid problems. So common fluid problems can be either fluid deficit or fluid excess. In fluid deficits, yeah, the cause of fluid deficits can be from diarrhea, vomiting, yeah, or fever and sweating. Can also be caused by bleeding and also the effect of diuretics drugs. The sign of fluid deficits includes thirst, dry mouth, and decreased urine. But in the moderate level of fluid deficits can be sunken eyes, poor skin turgor, fast heart rate. And in the severe case, we will find low blood pressure, weak pulse, and also cold, clammy skin, especially on the hand, and confusion, little to no urine output. On the other hand, in the fluid excess, we will find swelling or edema in the legs or ankles, and then we will find weight gain, shortness of breath, accumulation of the fluid in the lungs, crackles in the lungs, and raised jugular vein pressure or jugular vein distension. The cause of fluid excess can include heart failure, kidney problems, and too much IV fluids, and high sodium intake. There are also common problems in electrolytes balance. Natrium imbalance can be hyponatremia or hypernatremia. Hyponatremia can cause headache, nausea, confusion, and also seizure in a severe case. The cause of hyponatremia can be excess water, diarrhea or vomiting, and certain drugs effect. Hypernatremia can cause intense thirst, dry mouth, restlessness. Severe case can cause confusion or even seizure. The cause of hypernatremia can be from water loss, not drinking enough, or too much sodium intake. Electrolytes problem in potassium or kalium can be hypokalemia or hyperkalemia. So hypokalemia can cause weakness, muscle cramps, constipation, and irregular heartbeat. The cause of hypokalemia can be from vomiting or diarrhea, from diuretics effect, or poor intake of kalium or potassium. Hyperkalemia can cause tingling, weakness, palpitation, and risk of dangerous arrhythmias or cardiac arrest. That's why the kalium the kalium level in people with heart disease is very important to be watched closely. Yeah, the cause of hyperkalemia can be from kidney failure or potassium supplements or tissue breakdown process. When we treat people with fluid or electrolyte problems, we usually use three kinds of IV fluids. It depends on the condition of the patient. The common fluids that we use for resuscitation of the patient with dehydration is usually isotonic fluids. Isotonic means the tonicity of the fluid is almost the same as the tonicity of our body fluid. So the function of this isotonic fluid is to expand the intravascular volume, and it is commonly used for fluid resuscitation. For certain case, when the patient has high level of natrium in the blood already, we usually use the fluid with the less natrium in it. Yeah, we call it hypertonic fluid. But when we use this fluid, we need to watch closely for cerebral edema, yeah, the risk of swelling. And then the last type of fluid is hypertonic fluid. So different than hypertonic, in the hypertonic, there are more salt, more natrium in the fluid. We usually give this fluid for the patient with low level of natrium in the blood. But we have to use it very carefully and keep monitoring the natrium level of the blood.